guys know someone, you might know someone who like is really into fear, and they're really up for a challenge. It could be a friend, a foe, or even a child that where the moment you say something is not possible, they're like already jumping halfway down the cliff just to prove that they can fly and they got this. I have two of those at home. So it's, and I realized that that's where that conviction comes from innately. And then my friend, when I told her I was coming to Berlin, Vanessa, she's like, "Omar, I'm going to give you your superwoman cape." I was like, I really need that in case we need to take off during this presentation. And it's that energy that informs, where you can question, where you don't accept things blindly, and giving up is almost not an option. You kind of really have to work away around your situation. So to solve that, I was like, you know what? I'll study neuroscience. That will be the first step of understanding why I feel like I flew over the cuckoo's nest. If there's anyone out there in the audience, I totally relate with you with this feeling, because then that's what led me to kind of get away from the Starbucks life in New York. I was like, this routine thing is not working, and move to Kenya, back home, where I found fellow cuckoos that were committed to making a difference in the community. So we came together with a team of guys who already wake up at 3 a.m. in the morning, get on the boat, go through the mangroves to faraway communities, and just for the basic service, primary health care, maternal health, and immunizations. And what was at that time, the next day, borrow an old Land Cruiser and jet through the landscapes, passing like landmine warning signs, which you could say were almost like invisible. And it wasn't because of, this pursuit of danger. It was because of a pursuit of hope. It was like, you know what, where no one's going, we can go and make that difference. I remember those sharp bites of the tsetse flies. You're just like, you can't tell if you're the one who's hurting yourself or if the fly is the one that's actually biting, and sleeping on the floors. And if you have ever met the most famous African DJ, I kid you not, DJ Mosquito will keep you up all night. And all of that was like nothing compared to the joy of a pregnant mother being there in time, or delivering that first immunization, or a child coming with the dog from the farm and getting, the rabies shot. It felt simple, but not so simple when you look at the realities in rural healthcare. So there we are with the women, pregnant myself. I was 8 months pregnant at this time, and literally being able to conduct clinics that especially much needed by women and children. And that takes me to when I was a child. I'll take you back a little bit and explain that context. I was extremely frustrated growing up by all the myths, all the rules, all the hula-baloo around being a woman. The first one, no offense to the men, I don't know how it came from your ribs. I still need some explanation for that part. And then there's all these like policies and, what you should do, how, like literally like laws that are made in boardrooms. And then you go into the fact, what we call, I call it as female gender mutilation, because it comes in all shapes and forms. And so that for me was a little disturbing until that one day when this image popped up. And it literally defined my agency as a woman. I didn't come from anyone's rib. You all came from here, the uterus, right? And that's science. But why is this science not such common sense? I didn't grow up as a little girl like being told to, celebrate this power of nurturing a life or being the gateway to that first breath. So when I came across this image, it was then when I was like, okay, I'm going to stop asking all the whys, get to work. Let's get, to the action. The questions will be endless. And how do you work more towards the solutions around it? So this, we can agree, is, it's the gateway, because every one of us of here began with that first breath, right? Everyone? Yeah, just checking with all the AI that's happening around us. More of African imagination as opposed to artificial intelligence. So coming from that gateway is that I was like, it can be my absolute duty. This is women are the essential ingredient to that first breath, and that's not a question. But now when that lease is up in the uterus and we have to go out there, then here's where our stories start to diverge in different directions. When we were in here, we all had heating, we all had food, it was like standard, right? And then you come out and realities, start going in different directions. For myself, it was December 2013, a nice, beautiful winter. And I had that blessing of, okay, I'm going to welcome that first breath in like at home. I found a doula who also went to Oberlin College all the way in Ohio. I was like, this must be a cosmic sign we're doing the right thing, and had the grapes and the coconut water in the fridge. The bed was all laid out, the candles, oh my god, the candles in the apartment were like out of control. I think I'd watched too many movies about an ideal delivery, and Umi was her name. My name is Umra, her name is Umi. It's like, this would be amazing. And walking to the bathtub and back, and she's like, okay, your water's broke. We need to start pushing. And I'm like, push what? There's like no pushing sensation. 2 hours, 4 hours, 6 hours, like, nope, no pushing sensation. And so we end up at the New York Presbyterian Hospital with an emergency C-section. And I kid you not, this 9-pound something Michelin thing was literally like ripped out of my body. Safe, breathing, not an ending as I had imagined, but still a perfect ending to what any mother could expect. In my reality in Kenya, 1,000 miles away, Amina was also expecting. And in labor with her grandmother, who's the traditional birth attendant, stuck. She couldn't, baby couldn't come out. And I get a message, Umra, we need help. We need an evacuation. It's in the middle of the night. It's in the Boni forest. Security checks everywhere. No vehicle in sight. And it's the most helpless feeling as a fellow mother that you could possibly imagine. Because you almost feel like the end is inevitable. And the biggest question is, why does geography play such a critical role in survival of that first breath? And if we look at the statistics around that, the numbers are, over almost half of the population will live in rural communities, like 43% live in rural areas. And over 90% of these areas are the ones that contribute the highest to maternal mortality. And then we had, it's 3 times less likely for you to make it when you are in that rural setting. And for where we come from on the continent of Africa, we contribute to 70% of the maternal mortality deaths. And this is it's not by accident, it's by design. As my 9-year-old daughter will tell you when you cut her screen time, Mama, the math is not mathing. I deserve more time to play. And, and she can say, she's like, it's not fair. I calculated the time and I have 7 more minutes left. And it's like, the math is not mathing here, if you ask me. The math for newborn breaths is not mathing at all. And it's not by accident. The math is informed by the existing Eurocentric values, patriarchal norms, and a capitalistic agenda when it comes to the woman body. I think we cannot talk about healthcare to the last mile if we don't understand how to decolonize the models of healthcare, how to take the decisions to the women who are the central part of this equation. So when we are looking for solutions is that, whether it's Kenya, whether it's globally, whether it's here where we are in Berlin, is that how can we realize that these are not just numbers, these are realities, these are first breaths that should have gotten an equal opportunity, and that this can be done. Many community-based organizations will tell you, many social enterprises will tell you that we can't sit around waiting for decisions in the boardroom, and we can't put the burden on our, professional healthcare workers in facilities that are already overburdened and overstaffed. But what we can do is realize what we call community health workers. In China in the 60s, they had barefoot doctors. And we're talking of the first point of care, imagining a world where we could redesign the healthcare system to go to the doorstep of the communities and by the people that breathe in the trust into service provision. So, what is it like to be determined by geography? It shouldn't be the case, which is where our work, the team with Safari Doctors, is that, who's been in a rural part of, any country? Did you find a Coca-Cola there? Did you find a Coca-Cola there? So if Coca-Cola has figured out this supply chain, and not just for a Coke, but a very cold Coke, I'm talking like it's. We need to do that with the first breath. Our systems need to guarantee a healthy first breath at the last mile. It's not impossible. It's not rocket science. It's being done, and the numbers speak to themselves in regions that do have health workers. What I mentioned with the barefoot doctors, by over 90%, the key indicators in rural healthcare were able to be transformed. So, on what we do, believe it or not, sometimes we spend like 2 or 3 days over there. I'm talking like with sailors, and you can imagine what kind of nights those are with the snoring, because they literally do snore. And it's the journey that we make. We know the word safari. Many people ask me, like, Umra, why did you found the, safari? And my sister came up with that name is because, we see it as this luxury expedition going into the wild. Google and all the other anthropologists will tell you, you should definitely go on a safari, especially the one in Kenya. But for us, safari has a different word. It's a journey between the first breath and what could be the last breath. And so, how do we ensure that every month that we travel to over 1,000 of patients, and also training of youth as community health workers, plus mobilizing women's groups as agents of change to hold the systems accountable for purposes of sustainability? That's that Safari Doctor's journey that we're blessed to be able to get on. And what we took from this journey is that over 80% of community health workers are women. That's our mothers, our sisters, our daughters. They're the ones who are there at that first point of care. And how can we make this, how can we play our role in ensuring that there's the adequate training, they're skilled? And then the key word that we bring in is compensated. I don't think any one of you here reports to work and doesn't get your salary at the end of the month, do you? We're like, okay, let's see one hand over there. I'll talk to him after the presentation. Where, you're like, okay, I'm going to go get training as an anesthesiologist, and then I'll just, hang out in the hospital and get my work done. Because that's exactly what this role is how do we create health systems that literally cover the reality of the communities? And allow me to digress about realities, right? When we talk about reality of a community, and I mentioned the issue of working with colonized patriarchal capitalist health systems to this very day, I remember with my baby and we're trying to figure out this sleeping thing, and then there's that febrilization where let the kid cry themselves to sleep. And it was such a huge debate about, who designed this, who decided this. It was some Mr. What was his name? Luther from 1894, who never had a baby, by the way. And you're like, what are these models? In the morning, we got the question that what's healthcare designed for? It's designed for especially the white man who comes in, has a little, stomach ache, can go to the hospital, can get care. The research is then done around that. But then when you look at women, for us, it's different. You're in a particular ecosystem. You're with a community. There's the indigenous knowledge that cannot be ignored. So how do we shift the gaze to be able to focus on that? I'll give you another example of the patriarchal side. You're more likely to find in this middle of nowhere a condom than you are to find a menstruation pad at the shop. And not only is the condom there, it's free. Why is there a free condom if I can't find a menstruation pad where I am? Those are like simple examples of a much bigger structure when it comes to ensuring that a first breath does occur. So I found here with you today, draped in my power cloth, with the conclusion, understanding, the science is clear. We all agree that for the first breath to fully thrive and for a newborn to survive, we need to detect early. We need to ensure there's warmth, breastfeeding wherever possible, but nourishment, prevention of sickness, and definitely skilled care. So that's clear as day. Not a day in Berlin, sorry. But you can come with me to Kenya tomorrow if you wish. So that's clear. Our task now here is to ensure that this science is human and accessible. It's human and accessible. How do we move it from the textbooks to the last mile? And it's because of these last mile unsung heroes, the snoring sailors, the community health workers, that I get to stand in front of you here today in Berlin as a very, very great honor. And being able to be part of that journey of that first breath, I count that as like it's the wind that blows the sail of what I do, that blows the work in that direction of purpose, of hope, of making a difference. One of my favorite African proverbs goes back to the DJ. If you feel like you're too small to make a difference, spend the night with DJ Mosquito, and you realize how big of an impact you can make in whatever way. So on that note, may you be, draped in the power of that first breath. That is what, links you to the breath of the future generations, whose future we've borrowed, by the way. So this is not really ours. And with that power is let's fuel the hope, the possibility, and the future that is unfolding. So thank you. Danke schön.